Hello, everybody, and welcome back to the Patient First podcast. I'm excited that you're here, and I'm very excited. We have an honor to have a great guest today, Dr. Parul Makkar, who is a general dentist, speaker, author, and grief coach based in Long Island, New York. She's the owner of PDM Family Dental and the founder of Do a Good Job, dedicated to oral cancer awareness and healthcare grief support. After losing her only sibling, Dr. Manu Dua, to oral cancer, Dr. Makkar turned her grief into purpose, educating healthcare professionals on early cancer detection and guiding them through the emotional toll of loss and caregiving. She speaks nationally on oral health, grief, and the power of healing through advocacy. Dr. Makkar, thank you so much for being on the podcast.
Thank you so much for having me, Bryan.
Well, what's your,
Please call me Parul.
What's that?
Please call me Parul.
Oh, Parul. Okay. Thank you. And you can call me Barry. Just kidding. Inside joke from about 30 seconds ago. What you're talking about, first of all, I'm sure your personal story of loss resonates with a lot of listeners today. And I'm sorry for your loss. But there's very few people actually turn loss into such a mission and a purpose. You know, your mission and purpose is around not just grief, but also something that I think is under highlighted in dentistry, which is oral cancer, which, we talk a lot on this podcast about the overall health and oral health connections, how oral health is the gateway to overall health. And, nothing makes that connection more easy to understand for people than oral cancer. So could you kind of describe a little bit about your journey and what you're seeing today? Because, one piece that I would love to discuss is that when I got out of dental school 25 years ago, we talked about oral cancer. We talked about the importance of screenings. And there was this sort of what I would say surgence of tools and technology that came out around oral cancer. And then it kind of went away. And now I see that coming back again. And I don't know. And so if you could also talk a little bit about that.
Sure. So, well, first of all, thank you for having me as your guest today. I appreciate it. And, I've been practicing for a couple of decades now. This journey of me speaking and talking about oral cancer was never on the radar, but I lost my brother who had followed my footsteps into dentistry. We used to go and, discuss cases together. We went to courses together. And we were almost 8 years apart. So the one thing that really bonded us together was dentistry, love or hate of it. And he died in the midst of COVID. And being a dentist himself, he had a late diagnosis. He was on early prednisone without having a biopsy and knowing what it was. So getting on an immunocompressant drug while he is battling cancer, and which I think made this cancer worse. So this is why I wanted to share that I didn't want more cases like Manu's. That he was young, he was 34 when he died, early 30, 32 under diagnosis. So I wanted to change the narrative, and that's where my journey kind of started organically beginning. And here we are with Do a Good Job, the course thing, and the books. But what I have noticed, as newer and newer dentists are coming out, you're right. Oral health is the gateway to overall health. There's been a lot of, changes in medical practices, recognizing the links between oral care and overall health, even by the WHO, CDC, the cancer associations. But in dentistry, with young graduates with overwhelming loans, and maybe they are in a DSO practice where they have to see X amount of patients and make X amount of dollars. Sometimes that element between, getting a relationship with the patient is missed. And they're not doing these oral cancer screenings because there is no ROI, so to speak, out of it, because it's not a billable procedure. And so you're not being able to, and sometimes gets overlooked or bypassed or been like, pushed to the side. Yeah, oh yeah, you have a lesion. Oh, you must be just brushing against. You must have bitten your tongue. Don't worry about it, And so it's getting that awareness back. And yes, there are tools that can be used in adjunct to detect. However, at this point, you really need to do a biopsy to get a true diagnosis of oral cancer.
It's fairly recent that Manu passed. So I'm sorry for your loss. And I just applaud all of what you're doing to try to help others. You're a dentist. he was a dentist, and still, this can sneak up on you. And so it's
Right.
really important to, and because in my career, I had one patient that did get diagnosed with oral cancer that we did send in for a biopsy. And I would say that's probably one, certainly out of 100, probably more,
Yeah.
because back and we used to do brush biopsies to screen lots of false positives. And so I think it is, to your point, it's important to have those false positives so that you can find the one that the one that isn't, right.
And you will find false positive. 80% of the white lesions are benign and there's nothing wrong with them. But, you know, finding a later diagnosis, the cases of or chance of the patient surviving are poor. So we want that early diagnosis. It's okay to get that false positive because you are going to end up saving somebody's life.
I want to ask you about something. So my new book that is coming out soon. I have a chapter in it called "What Medicine Gets Right and Wrong and What Dentistry Gets Right and Wrong," because I think that medicine and dentistry are messed up in different ways. And one of the things that I put dentistry gets right versus medicine is prevention, focusing prevention. And obviously not perfect, but frankly, I think in dentistry, we do focus on prevention much more than our medical colleagues, but not when it comes to oral cancer by and large. Why do you think that is? Because I think we do focus on, or maybe we don't. Maybe that's another way that I'd ask the question. Do you think that dentistry is in prevention, and we need to step it up across the board, or is oral cancer screening sort of a specific narrower area that we need to focus?
I mean, you are right. Yes, we talk a lot about prevention, brush and floss your teeth, come to the dentist, take x-rays. And, there are certain products you can use to reverse caries now and preventing it from getting bigger. However, with oral cancer, we need to be a little bit more diligent on talking to our patients. We cannot change somebody's lifestyle with choices they've made, whether they're vaping, smoking, heavy drinkers. But there are little changes we can make. Especially if the problem becomes in the young teen adult who is vaping or using snuff, like Zyn products. And sometimes we don't know it or they're not claiming about it when they're with their parents and things like that get missed. We're not talking about one of the reasons that there is an increase in oral cancer. It's specifically the oropharyngeal cancers, which are in the back throat of posterior region, is because of human papillomavirus, which is a sexually transmitted disease, and it is more so than STDs. So while there is cervical cancer pap smears to check for cervical cancers, there's no true diagnosis check for oral cancer. So that's another like misstep or our barrier. And so it really is about doing these screenings and having those conversations that we don't have with our patients. We're not talking about their sexual practices. We're not asking them. You may go to your doctors. Oh yeah, have you been vaccinated for flu? Have you been vaccinated for your or a certain age? Are you getting your shingles? That's it,
Yeah.
shingles.
Okay.
So we're talking about these things in medicine, but we're not talking about hey, did you get your HPV vaccine as a young teen? So that's where prevention comes in, and we're not talking about any of those topics. We may ask the patient, "Oh, you're smoking. Shouldn't be smoking," or "Oh, you had an extraction and you're going to smoke after that?" "No, you cannot smoke after that. Wait for 2 hours, 2 days." But we're not talking about seizing the habit as much unless they go into more of, I'm talking about a general practice. Of course, if you're community based, if you're in a different setting, yes. But, in a private practice, these things are not being discussed. So that is the lack and not having the awareness that, oh, you can actually die of oral cancer. Nobody thinks that. People think they die of breast cancer because it becomes metastatic, and you hear more. There's awareness. There's global awareness to it, but not so much for oral cancer. So a little bit of public knowledge and acknowledgement, and that's where we need to, as dentists, step up and say, yeah, April's our month. We need to get screened. You know how to do a breast exam at home. You should know how to do an oral exam at home. Check your tongue. Check anything that is, you know how to look for skin cancer, melanomas, or any moles that look abnormal. So these little tips, we need to be bringing that awareness into not only the dentists, medical doctors, but also the general population.
I think that's a teaching patients how to do their own oral screening. I think would be that. And frankly, you're the first person I've heard mention that, and I think it makes all the sense in the world. I think another thing that I think you likely agree with, and so I'll ask you this as a statement that you can either validate or what your thoughts are. That when people talk about when they're talking about oral health as the gateway to overall health and medical dental integration, I that dentists are thinking that it's on physicians to learn more about oral health. And having spent the last several years, researching with the kind of content of my book and with physicians and going to health conferences, that is not the way that physicians view this, in my opinion. I think that we as dentists have to look at the overall health of the patient, as you're referencing, versus dentists or physicians being more in tune with dentistry. Because let's face it, they
And
have a much broader range. And, if you're an orthopedic surgeon, you still have to look at the overall health of the patient. But in dentistry, we use the medical history of the patient as sort of a screening tool, not as a comprehensive element of their oral health care. Are you agree with that perspective?
absolutely. Absolutely. I see slow changes coming along with salivary testing. Okay, let's check what is your oral microbe looks like. Maybe we should combine it with some probiotics. And so little by little, the change is coming with more holistic dentistry that is trying to integrate that medical link, especially with patients who are diabetic, who are getting cavities but have no, now what's wrong with their saliva? Is the pH, low? What's going on? Even though they're healthy generally, but why are they getting cavities? So yes, this change is coming, but you're right. Medicine kind of glosses over the dentistry aspect of it, even if you show them, like, voila, here it is, and they'll gloss over it. But we as dentists, and when they're coming to see the dentist, when patients come, they're like, I just want a cleaning. I don't want even an x-ray. And you're like, but I need it to know what's going on with your mouth. I cannot diagnose without x-rays. And so we all these little, barriers sometimes, but building that trust between the patient that no, we're not doing this because we can bill you for a service. We're doing this because we want to assess you properly, especially if you're a new patient. And then we have to get to that next, we're like, okay, yes, we're not medical doctors, but hey, we can do this to help you with your overall health. So there's a lot of work to be done, but it is an uphill battle sometimes.
How do you square the circle of what you referenced previously, which I think is a large issue in dentistry and healthcare in general, that we get paid to perform procedures, not to enhance people's wellness. And this is one aspect of that. And I don't, I have my thoughts of how we can have the right incentives maybe in place, I would say. But this is kind of a broad question. So it's an unfair question to ask you, but I'm going to ask it anyway, just in case you have some ideas. How can we incorporate prevention into our practices so that it's good for both the health of our business and also the wellness of our patients?
Mm, One is building the patient's trust, right? That's the first thing. They're not going to believe you if they don't trust you. So sometimes a lot of this comes from preconceived notions of the patient. For example, if you're out in the community and you are providing services, maybe you're out doing free cancer screenings, you're talking about health education to schools, to colleges, so where you're seen. So building that initial trust when the patient comes to you, they already have that, oh, this doctor is not going to just drill fill and bill, but they're actually really caring about me as an individual. And they're out there showing this work, whether it's your Instagram, whether it's your TikTok, whether you're putting out blogs, newsletters, mailings, whatever it is that you're doing, that you are the source to help build that connection on prevention of dental decay or of oral cancer or periodontal disease. And so I think that's kind of the first step is building that relationship. As it is, dentists are, not the most trusted. We always get, oh, I hate coming here. And what do you mean? What are you doing? I can't see. So showing patients really having them be accountable for what their mouths look like. So showing intraoral pictures, now there's AI technology with rid of gaps. That all comes with patient education. I think, showing these things like, look, what did you look like before? Here are your numbers. What, when you're doing periodontal measurements, look, we saw this lesion. Oh, it's cleared up in 2 weeks, or you're good, or no, it's grown bigger. Let's send off for a biopsy. Oh, here's a tooth, and you see how it's, your vertical dimension is dropped because you're grinding. Here's what it looks like, bring in sleep, whatever you're trying to help promote. I think that's how we can help our patients is creating that space to actually sit and talk to the patient and realize the value in them coming to you. So you're not seeing 10 patients, in 2 hours. You're actually seeing one patient an hour, and you're actually able to bill your time for that, right? So it's also what kind of practice module you're in, that you can have the ability to spend the time with the patient. So that all comes from creating what the patient needs. So,
Yeah, I completely agree.
mhm,
We call it at Two Thaps, we call it the return on patient experience. I
right,
think that, when you give patients, when you show people that you care for more for them, you'll have higher case acceptance, you'll have better retention. Basically, you make more money if you show people you care for them, right?
right,
Uh,
yeah.
it is one of those things where you have to slow down to go faster in a lot of ways. I agree with everything that you said. And I believe that, well, I had a CEO of a DSO ask me about what he could do about hygienist wages. Like, wages have gone crazy. Obviously, reimbursement has not gone anywhere except maybe down. And so there's this squeeze for how can we have the same team members. And of course, we have had a lot of hygienists leave the profession. And I said, well, a lot of that is true. A lot of people have left the profession. But what's also true is that about half of the employees are looking to switch jobs because they're not happy in the role that they're in today. And that's the biggest problem. So, how do we make a position for team members that they want to be part of? And I
Mm,
think it is what we're talking about. It's, talking about the importance of overall health, giving our team members the ability to educate patients, giving our team members the ability to do procedures that incorporate overall health that some may not be covered by insurance and the patient's just direct pays. Some may be screening that you're doing, that you're educating the patient that will translate into a return on your more positive experience. I think that is the future of where we're headed. So I'd love you to talk a little bit about your materials, your course, how you train people to incorporate this into their practice, and more about do a good job and what you're doing with that important initiative.
So, do a good job stems from my maiden name, and it's a pun off the name. But
We have bad joked every Tuesday, and so I'm a big fan of puns. So I appreciate the name.
yeah, my brother coined it. I just ran off with it. He's not there, so half for that. But so the course is designed really for anyone to take in medical or dental. And what I did was it's divided into many modules, bite size in a sense. They're short, 30, 40 minutes, and you can come back to it whenever you need to, but it's going into what oral cancer is. So, why the cases are increasing, what's the risk factor, so on and so forth. And also, how to recognize the most common lesions, white and red, why. And people can actually. So if you have your team, and that's a really great point that you made up, that having the team be accountable, have the team be trained also. So when you're because oral cancer is not just an isolated, oh, the hygienist saw, the dentist came in, oh, yeah, we need to get that biopsy. Here's a script, and off you go, and end of story. But no, the hygienist may look at it. The assistant, when taking x rays, may say, oh, that looks kind of fishy there. When I was taking backup on the right, the molar, I saw something. So I created printable common white and red lesions, what you should be looking out for, and what cancer looks like, versus so people can have that tangible in their practices for their team members. And also, what goes beyond that, right? How do you take care of the patient afterwards? What products can you use? What challenges do they have, whether it's with wound care, with oral care, with family members? I'm going to have a whole topic just on dealing with grief of having a patient do with it. going through, because it's not isolated to the patient. The patient's going to step up and go to the front desk and be like, I have to go see an oral surgeon. I'm scared. The word biopsy is scary. You're going to a stranger you don't know, a new doctor, to get possibly the worst news of your life. So it can be quite overwhelming, and they're going to delay. So one of the things that I really propone for is that learn how to do your biopsy yourself, especially if you're doing surgical extractions, you're placing implants. You can do a biopsy at that point. It's not hard work. And it helps build your practice. It shortens the time of detection, and your patient is more, is going to stay within the practice and is not stepping away and going to a new doctor. And now there's a follow up. So that's another point that I advocate for and I teach on my course. What are the different types of biopsies, how you can do in yourself, salivary testing. Not that there is for oral cancer, however, it can help with other forms of cancer. So the course goes quite into depth into all these different factors, and also dealing with the emotional for the team. They're going to go to the front desk. They're going to talk to the assistant. I'm scared. And staff members always will say they talk to me differently than they talk to you. They share differently. They're paying them. They're finding, what's my copay? Should I really do the biopsy? Can I wait till next week? And things always come up. So it's getting the team trained for everything, not just the doctor diagnosing, but also how to now take care of this patient. Do we need fluoride trays? Do we need certain rinses? What other things are they going to be expecting? And another fault or misstep I see is that when patients go in for surgery, they're not getting dental clearances all the time. I had a friend, she's young, she's in her late 40s. She just got diagnosed with cancer, and they had to do a PET scan. On the PET scan, one of her teeth lit up. She needed a root canal. And the PET scan was done to see if there was any metastasis, because there was node involvement. But there was no dental checkup before she went for her mastectomy. There is no dental checkup before they go for certain procedures. And I think that's where also things need to change, that any patient going for any surgery, whether it's a knee replacement, heart surgery, cancer treatment, whatever, needs to be cleared, because we know the complications that can happen after the fact the surgery is done, and now we can't do anything and the patient has an emergency in the mouth. What do you do? you know so all these little things.
Completely. In fact, it's the time that we just, as part of Dental Standards Institute, I was just working with a work group yesterday, and we're putting the final wraps on what we're calling the oral wellness, where it's basically like 1, 2, 3, 4 grading of your oral wellness. And it's meant particularly for doing things like screenings. We're working with the same people that created the readiness status for the military to be deployed. We should certainly have the same kind of criteria in dentistry.
Absolutely.
Yeah, that's been something that we've been working on for a few years, and it's about ready to be submitted to ANSI. So I'm excited about that. Thank you so much for being on the podcast. What you're doing is so important. I hadn't thought about, frankly, which is a bit embarrassing to admit, the importance of teaching our team members to basically train them on how to deal with the emotions that patients are feeling around some of the diagnoses that come through our offices. I think that's such a huge component that you highlight in your course. I think if you're running a dental practice, I think getting this training is crucial it's for the times, when you don't know that things are going to happen, and then but then your team has to be sort of prepared to have these difficult conversations with patients. And so I think it's crucial. So where can people go to sign up for your course?
Sure. Instagram at Do a Good Job, or you can go to the website, DUA Good Job. I have a free ebook just to learn basics about oral cancer, but to get in depth, DUAGoodjob.com. And we don't talk about these aspects. I'm actually going to be speaking to the American Academy of Oral Maxillofacial Prosthodontists in October on the unseen scars of cancer, because even as dentists, the emotional burden that we carry every day, some of these little micro stressors that we have during the entire day, whether it's scene practices, patient care, and everybody wants a little bit of us, and we are trying to make everybody happy but ourselves. And especially if you're dealing, that population deals a lot with cancer patients, the emotional toll that it takes as a provider, we just don't talk about it. It's not, we all want to show the cheery, successful dentist, but not the burdened, emotionally worn out dentist. But it happens and it's okay. But it's just learning how to find those resources and get help. But yes, do a good job is the place to go to.
That's great. Thank you very much for all you do. Yeah, I could not agree more with you on the difficulty, the challenges of being a healthcare provider. I argue in my first book that is what ends up leading to us basically unconsciously disconnecting from our patients' emotions, right?
Yeah.
Because if we are empathetic and we absorb that stress, we're going to have miserable short careers. So being compassionate and being able to have conversations without absorbing other people's anxiety and discomfort, I think, and grief is crucial if we're going to provide the best level of care, but not have it impact us personally.
Absolutely.
So, thank you so much for being on the podcast. Everybody should go to DUA, DUA, goodjob.com and do a good job on Instagram. If I was on Instagram, I'd check it out, but I'll have to go to the website. Thank you, Parul, for being on the website, on the podcast so much, and appreciate your time.
Yeah, it was a pleasure. Thank you.